We are taking live to Canberra now. The Aged Care Minister Anika Wells is speaking on aged care reforms.
Let's not walk away from the fact that that was a desperate last gasp measure. So I think I'm sort of looking at this in two facets. I've got to get aged care through this winter, and then I've got to start the reform process so that we don't have winters like this again. So what are we doing? I pulled together a couple of weeks ago now a summit of the Chief Medical Officer, the Deputy Chief Medical Officer, nursing advocates, and I put them all in one room and I said, right, I'm the new Aged Care Minister, no stone unturned. What are all the things that I can do that have either been rejected before, that haven't been considered before, that you tried and didn't work? Like, what can I do? And together that formed what is now our aged care winter plan that we launched a couple of weeks ago now, has 5 elements to it. And those measures, many of those continue well beyond the ADF will be leaving.
Minister, if I could just ask a couple of things. One, on the workforce, this number 869, does that take into account the huge numbers we're expecting to leave the workforce? There's been surveys showing how many people are wanting to leave in the next couple of years. And secondly, did you tag the Prime Minister before he made that try? We already need to know, unfortunately.
Let's do aged care and then move to sport. I promise to come back to you on my extremely serious duties in the sports portfolio, but the 869 figure, I mean, that is the modelling provided by the Department of Health and Aged Care. That is also modelling that was available to the previous government and that came up at April estimates, if you look at it. So I am perplexed as to why they keep prosecuting the validity of that number. But I would say, and I probably risk further ire of the opposition by introducing a bit of nuance to this debate, but there are lots of different numbers because everybody's got their own modelling on what this is going to look like. This isn't tuck shop prices, like this is complex policy, and there are people leaving the sector and we need to bring people back to the sector. So that is the modelling that the department, my department, has given me for what we need to do to deliver our election commitment. There will be other modelling out there, and even as to where that looks like in 1 July next year, when different things will have happened. Probably by 1 July next year, we'll have a decision from the Fair Work Commission about pay. Probably by 1 July next year, some of the other measures as part of our winter plan will have rolled out. So things will look a bit different then. I think that answers the question.
Just a question about the bill passed today. Just a question on the bill passed today, just with the new funding model. There have been concerns about the Independent Health and Aged Care Pricing Authority leaving discretion to the government to veto their pricing. Can you give a commitment that the government will cover the full cost of delivering care under this new model?
I think this is one of those ones where it speaks to us doing more by way of transparency and accountability. That was our election commitment. So what we have committed to do is to release the advice and to table it in the Parliament. And we will do that regularly so that everybody can see the advice that we are giving. As to the funding, that is very much a question for the Treasurer, but I will always be advocating for more in aged care. Back to you, Josh.
Yeah, just on the 24/7 nurses, what's the sector telling you about their concerns in meeting, I guess, that requirement? And can you, I know this is probably part of the Senate consultation committee as well, but what sort of exemptions are you considering, or what sort of exemptions would you see could be given to that role? Would you imagine there would be pretty limited exemptions for that 24/7 nursing requirement?
I think there's a number of elements to that. I think people are expressing their concerns and I welcome it. I think that people feel they were a bit out in the cold previously with the previous government in aged care, and we're doing our best to be really consultative and listen to people's concerns. That is exactly why we've sent our election commitment reform bill off to Senate inquiry so that those kinds of things can be worked through. And that's also why we want to do this with consultation through the sector and why we've put the 1 July next year start time to give us the time to do that. People are concerned about, obviously, regional and remote Australia. People want to see how, and people also, I think, have suggestions about how we can do that well. So mostly when we talk about exemptions, it's about those thin markets. But I think also when people are raising concerns, they're saying we've got answers if we take the time to do it properly. So ultimately, I want to do it once, I want to do it well, and that starts with the Senate inquiry.
Minister,